We, in the course of their work, A&M talked with over 800 of you all. Thank you all for engaging in the work. It's really probably the most important thing that we're doing. We are now looking forward today to presenting to you our findings and our priorities for improvement going forward. We're going to start with just a little bit of context. If we could go to the next slide, Aaron, or two. Yeah, just to remind people of the context of quality improvement in recent years. When I started at ODES in 2019, the office was under a plan of corrective action from CMS related to reportable events. A lot of you were engaged in helping us improve reporting. An electronic reporting system was implemented. We worked with many of you to ensure timeliness of response to reports and so on. We got the plan of corrective action fulfilled a few years later. But recently, more recently, last year, the abuse at Lee Residential um, came up and really prompted us to take another look at further systemic improvements that we can be making. We go to the next slide. We had already engaged Alvarez and Marcel to do some work with us around the access rule, which has a lot of overlaps with this work. The access rule will require us to do some clarification around reportable events and grievances, for example. We also, though, asked A&M to do some focused work for us around quality management system and what improvements we can make there. So that's what we're going to be reporting on today. With that, I'm going to turn it over to Betsy.
Thanks, Paul. So happy to be here with you all this morning as well. I am just going to talk a little bit about our overall focus on quality and to help us understand how the incident management work that's been done and been taken a look at over the course of the last couple of months connects with that. And you'll see this slide, which you may have seen in a previous presentation, but it just talks about everybody that we look at ODES who are so important to us when we think about the overall quality of our system and our services across the board. And of course, we've got advocates, you all, providers and case managers, individuals and families that we support, Office of Main Care Services, a close partner in all of this work, licensing and certification, and we'll be talking a little bit more about that in this presentation. And then, of course, all of our ODES services and supports that are offered and provided through our programming staff. Next slide. So next we have a wheel that was developed for us by Alvarez and Marcel. And we really like how it puts, at the center of the wheel that our goal is, of course, promoting independence, health, and safety within the community that we all work in. And then around that wheel are the areas that support all of the work that we're doing out there. So we have member safeguards, qualified providers, quality services, and broken down into those different sections. And then most importantly, we want to provide support across the board for the quality of life, a good quality of life for the people that we support. And at this time, I'm going to turn it over to Aaron and Chris, who are going to help walk us through a few more slides and then eventually get into some of the considerations that they're going to walk us through. So, Aaron.
Great. Thank you so much, Betsy and Paul, for that opening. Hi, everyone. My name is Erin. Like we've mentioned, myself and Chris are part of the A&M team that we're helping to take a look at OATS incident management practices for the sections 21 and 29 waiver programs. I'm taking a look at the attendee list and thankfully recognize a lot of names. So really great to see you all again. Like Betsy mentioned, we're going to walk through just a couple of slides, briefly recapping what the approach to the project was, what were some of our findings, and then we're going to talk about the considerations from the project. At that point, we are going to go through considerations in groups, and then we'll pause at the end of each group and open it up to the floor for discussion. So you might have noticed we're in a webinar format. There's a Q&A option. So if you have questions as we're going through slides, feel free to type them in, drop them in there. You can also raise your hand and then we will select that you can come off mute and ask your question. But for the time being, we'll hold on doing that until we get through the first group of considerations. We're going to walk through this content a little quickly so that we have plenty of time to talk about the considerations as a group. The report and a recording are going to be posted online. So if you see something that we move through quickly and you want to return to it, you'll be able to do that soon. So with that, this last slide, as we mentioned, was just, it represents the piece of that quality system wheel that incident management really lies in. And throughout this project, we really focused on the reportable events and reviews portion of that. And like we said, in sections 21 and 29. But to give a little bit of a summary of, what the project was looking to do, what were the context, this group is really familiar with the structure of OATS incident management system. And we wanted to outline here that, that is rooted in federal expectations. All states have to establish an incident management system for their HCBS programs. The key elements of that system, obviously, are that the system has to be able to find problems when they occur, has to be able to fix them, has to be able to resolve issues, and then has to take an approach at preventing those problems from occurring in the future. There's an expectation to demonstrate, through the system that states are taking efforts to try to prevent things like abuse, neglect, and exploitation from happening, and how they show that they are looking at the trend of incidents and implementing responses to keep them from happening again. This slide just covers the main activities of our project. So like Paul mentioned before, that second box from the left is our interested party engagement. We got to talk to over 800 participants, and a lot of the folks that are with us right now or maybe watching this later were a part of that engagement. And we really appreciate all the time that you dedicated and all the really great feedback and input you provided. In addition to all that engagement, we took a look at the current state of the system, looking at documents and procedures. We also took a look at what other states were doing and did a compliance assessment to see how OATS was lining up with federal expectations and guidance. And then that last piece where we're here today is developing a final report summarizing everything we've seen and then presenting considerations of what to do in the future to potentially help improve the incident management system. I know this group is really familiar with the different parts because of the unique roles that everyone here plays in incident management, but to kind of help organize our project and our findings, we've split up the incident management system into these 4 high-level buckets to really organize the key tasks and activities we're talking about. So they start from the beginning of just finding and being able to report incidents, then moving into how those incidents are reviewed, how you find out more information of what happened, then moving into, okay, we've got all the information, now we need to take the steps to resolve this specific incident and try to prevent things from happening again in the future. And that last piece being the analysis and information sharing that happens throughout the entire system. To be able to look at and identify whether there are trends and patterns in data to then be able to take action and implement improvements or solutions to promote quality and prevent things from happening again in the future. So real quickly, we're just going to go through a couple slides that summarize what we found from that current state assessment, all the engagement and feedback folks shared, and the look at other states and compliance with guidance. So we split it up by those big categories. So really with the discovery and reporting, the great thing we saw was just how much there's been more reporting and more timely reporting over time. There has been there were reports in what we saw, because there are so many groups involved in incident management, it can sometimes get a little confusing of who exactly do I need to report something to? Is it a complaint? Is it a reportable event? Where do I go? Similarly, in the review and investigation system, there's been a lot of improvement in looking at new procedures to make processes more efficient. So there's investment in technology, resources, processes to make sure there's really clear documentation and things can move quickly. On the flip side, there have been, there's always challenges whenever new processes are implemented or new tech systems are being used. And so just trying to make sure that the review and things can move forward in a timely manner is sometimes a challenge. The last two pieces of the system that we saw, we wanted to really acknowledge and commend that a lot of groups come together to solve issues. So whenever there's, major concerns that are identified through events that are reported, a lot of groups kind of will drop their other tasks to be able to focus on the immediate priorities of ensuring health and safety, making sure that the right steps are taken in that follow-up to make sure things don't happen again. And that's a really commendable practice. At the same time, something we've mentioned similarly before, when all of those groups jump in to help because of a commitment to ensuring health and safety, sometimes it can get tricky of who's the right owner for specific tasks. And if similar things are needed in the future, who are the right people to get involved? And lastly, on the information sharing, again, a lot of people are really working together in informal, collaborative ways to make sure folks have the right information to fulfill their roles sufficiently. But there is sometimes challenges in the systems and processes being used. Information sharing doesn't necessarily always have a formal standard process, and that can be challenging at times. The last thing we wanted to call out was just some findings we had that applied to the system as a whole that didn't really fit neatly into one of those four buckets. The first being the positive practice we really want to acknowledge is something we mentioned earlier, that the commitment to trying to make the system better was really apparent. There's a lot of when we started this project, there was an immediate willingness to dive in and talk about the challenges and what the potential solutions were, and a willingness to, adapt to make things better. And then what we also saw of some other topics were, the quarterly meetings between the quality assurance team and the providers, a great demonstration of partnership and trajectory towards that improvement, seeing that some of the meetings are practiced differently across the different districts, and wanting to see if there's a way to standardize the practice. And then as well, identifying there's different training topics that could be developed. So there's a lot of emphasis on what's an incident, how to report, but other nuanced topics of, what's trauma-informed care, what are the signs to look out for if someone might be in trouble. Those could be additional things that would strengthen the system. So I'm actually going to now, before we get into the considerations and the discussion, I'm going to turn it back to Paul and Betsy, who are just going to talk about, what does this all mean and some next steps.
Great. Thanks, Erin. Again, so we just wanted to provide a little high-level context before we get into the considerations. You're going to see lots of things that we are considering and for recommendations, and some of those things we'll be able to hopefully do sooner rather than later, depending on the resources that are involved. There are a number of things happening across our system, which I know many of you are aware of. Not to mention the work on the revisions to our licensing rule, which will be a fair amount of work that we're doing across our system and that many of you will be involved with. Hoping to have that rule out for public comment within the next month or so. And we also have a number of federal rules that we're going to be having to come into compliance with at this that we're looking at and making sure that we're going to be able to do that work. As we know, there's right now an existing federal landscape that we're paying very close attention to, which could impact what and when we can take on over the course of the next couple of years. So we'll be paying close attention to that and sharing with you all what those implications might be for us. And so, and also, you know, of course, just taking a look overall at the budgeting and the funding and resources that we have, in part because of possibly all of those things. But having said that, we are very much committed to this work and moving ahead with everything that we possibly can do. Want to go to the next slide, Erin? So we wanted to have you think about where we're headed or what we're thinking about in the future as you hear some of the considerations that Erin and Chris are going to talk about going forward. And what we're doing right now, we've already started a really good partnership between ODE's Quality Assurance folks and Adult Protective Services with the new Evergreen. I keep saying new. It's been in place now for over a year, but it's still new to many of us, of course. But we're able to do some sharing of information between Quality Assurance and Adult Protective now, which we've started doing, and that's really already helped us streamline some of the work that we are doing together so that we can address more quickly situations that are happening out there in our service system. We've identified some new technology to help us make the reportable events dashboard better, so we're going to be able to track data more quickly, and we'll be sharing that over the course of the next couple of months, hopefully. We've been developing and we are continuing to develop some new tools to check and make sure that things are working well across our system. Some in preparation for the licensing rule, but also to help us be in compliance with HCBS monitoring. So doing a lot of work, some of that with Alvarez and Marcel, some of that across our ODE staff have been doing a lot of work to develop those tools. And then, of course, I've already mentioned the new licensing rule, which will be coming out. So when we think about kind of where we're going to be going from here or what our plans are, you're going to hear about this in the considerations, but we will be working over the summer to establish an external HCBS quality improvement collaborative. And we'll be working with that collaborative as we move forward with some of that work and start implementing some of these changes across our system. We're excited about that. We'll also be creating an internal incident review committee to ODES, and that'll be something new for us to be doing so that we can internally make sure across our systems we're being consistent. We have new direct support professional curriculum that's under development. More about that coming probably midsummer. Will be lots of opportunities for people to take a look at that curriculum, give us feedback on that, what's there, what's missing, what do we need to take into consideration with that curriculum. So lots of opportunities for providers and advocacies and individuals to help us continue to shape what that curriculum will be as we roll that out over the course of the next really year. We've already talked about, or Erin talked about, our quality assurance meetings that are happening with providers, and we have some goals to make those as efficient as possible for providers and for us so that they can be more comprehensive, but also efficient. And then new ways to check quality and then share reports. And we've got some foundational work happening there. So with that, I'm going to turn it back to Erin and Chris to start walking through some of the considerations, but we just wanted to kind of talk about where we're headed so you can keep that in mind when you hear about some of the recommendations. Thanks, Erin.
Great, thank you. Okay, so like I mentioned, what we're going to do, we're going to go through considerations in groups. We're going to use those same buckets of the incident management system that we had introduced before, but we're going to go a little out of order, and we're going to start with the considerations for the incident management system as a whole. I'm going to read through the whole list, and then we'll get to a slide that relists all of the considerations in that group and open it up for discussion then. So the first consideration we have in this group for things that affect the whole incident management system is this idea of implementing a no wrong door approach. So what this really means is that there would continue to be multiple mechanisms to report different incident types or issues across the HCBS programs. However, the reporting mechanisms would be able to receive all reports, even if it was for something that didn't quite fit that group, and be able to pass it on to the correct recipient. This came about largely because we heard that it can often be confusing about knowing where to report certain things, especially for someone who may not know whether there's something that's a complaint versus a reportable event, and they may try to report it somewhere and get passed around to a lot of different groups, and eventually that report may not ever be made. So the real intention of a no wrong door approach is to make sure that all reports get captured, nothing slips through the cracks, and that there's an ability for and kind of a training on the back end to have the different groups partner together, pass along reports to the right group for their review and triage. The next consideration in this group is there are three that are tied together that are about enhancing the processes for the incident management system. So the first is recognizing a need to take a look at the quality assurance team processes and finding some opportunities for streamlining and making things more efficient. This really came about because the quality assurance team has gone through a lot of changes in the last few years due to, a lot of the things that Paul had mentioned at the beginning as context to the project. With that, the investment of technology, people, processes, there's been a lot of change, and sometimes there are some inefficient ways that the work is being done as changes are in progress. So this consideration is all about taking a look at all the work that's being done, identifying ways to make it easier and simpler. The real intent and benefit of doing that is to make sure that they have plenty of time and resources to be able to review and respond to incidents quickly, and that, not being bogged down in difficult processes that might make things take longer. Similarly, in this group of streamlining and enhancing processes, there's a consideration about contracting with a quality improvement organization or QIO-like entity. The idea here is really to recognize that the quality assurance team is responsible for a lot of different activities. And some of the responsibilities in incident management really are desk level type reviews that contracting with a different organization who can take care of that work could create bandwidth and time for the quality assurance team to focus on other important aspects to incident management, the technical support, the working with providers and case managers, dedicating more resources to going on site for the bigger problems. The idea here, again, is about making sure that there's an efficient distribution of work so that the right level of resources can be dedicated to bigger issues that need to be resolved more quickly. And also acknowledging the technology and analytics that the QIO type group could bring to the table to help add to the data capabilities for incident management. And lastly, in this group of three of considerations for enhancing processes is about taking a look at those quarterly meetings between providers and the QA team. We mentioned this before. Betsy talked about this as already something in progress of ways to make this more efficient. This is really, again, recognizing that we heard from, even some folks that are here today, that those meetings tend to be focused a lot more on compliance of whether things were reported on time, a little less so on the technical support that might be needed. So this is about identifying what's a standard approach and practice to these quality meetings that's needed. What's the right balance of looking at timeliness and providing technical support and making sure that that's applied across all of the districts. Continuing forward, one of our other considerations was about enhancing outreach to members, self-advocates, families, and guardians. We had really heard that there was a strong desire for more engagement with the state and different groups for them to be able to talk about concerns, talk about reportable events. There are lots of mechanisms in place for that engagement. So this is not necessarily saying, nix all the engagement before, come up with a lot of brand new ways to engage. Taking a look at what currently exists, identifying ways to streamline them, bring them together, making others more accessible, adjusting the format, whatever would make the intent of that engagement more effective and beneficial to the different groups. This also recognizes that, the perspective that members and self-advocates and their families have is really crucial in making sure that that has a strong role in ODE's, quality system and perspective on how services are being provided. The next consideration we have here is this idea of introducing, provider incident management report cards. So this term we're using is just to reference the idea of kind of cataloging some data about incident management for different providers. Now, knowing this group will probably have a lot of questions about this when we pause in a couple minutes. The idea behind this is really recognizing that members and families wanted a lot more information about different providers and agencies as they were looking for services for their loved ones, but also understanding that that data and information is often really subjective. And so this consideration is not about, tomorrow ODES is going to start putting out all of this public information about how providers are doing with reporting incidents on time, things like that. This is really suggesting that an internal effort and a strong partnership between ODES and providers take place to look at the data that's available about incident management, a really focused scope, talking about the reliability of the data. What does it show? What would it look like to compile that explicitly on an internal view first? See what kind of information that shows and presents, and whether that can help inform, how agencies are doing with quality with incident management, and how that can be incorporated to the quarterly meetings about quality and incident management. All of that before even considering whether this ever becomes something that is external or public facing. Really the emphasis being on the partnership between ODES and providers about the quality of data, what's presented, what is the purpose of that. And I'm actually going to pause and turn it to Chris, who might be able to add a little bit more about this.
Yeah, thanks, Erin. And as you may recall from looking at the slide that Betsy had covered, as far as what are those early things that we're looking at launching with ODES, this was not on that list. This is going to be an effort that requires a lot of collaboration and work with providers, members, and families. There's several steps that need to be done. Erin mentioned some of those. So it's identifying what are those meaningful metrics, and then making sure that the data is valid and reliable, because that's important. What's the methodology look like? And so it's taken into account provider size, acuity of people that providers support, because some people support more folks. And then really, while it's incident management focus that we're talking about today, it provides an opportunity to develop profiles that can start internal facing and potentially be used during those quarterly provider meetings. So it helps to better understand the data, better understand information that could be shared individually with the provider and ODES, as we're talking about quality improvement. And then at a later time, consider what are those mechanisms that would need to take place if we were going to turn any of this outward facing for informative purposes. So there's a lot of work that would have to go into this. Of course, providers would be actively involved in that process. So
great points there. And loving seeing that questions are popping up in the Q&A module already, and we'll turn to those shortly. We have just two other quick considerations in this section before we pause. These are all about the incident management training. So the first being recognizing that there is a need to potentially look at the process for how training is developed, approved, administered. There were a lot of reports we heard about the different types of trainings that are out there, the different versions, some being really recently updated, others having not been updated in a while. This consideration is about developing a really clear plan about how new training should be proposed, approved before it even gets developed, and then what are the right methods for releasing it, distributing it, and where is it going to be stored and available to kind of control the different versions that are out there to make sure all the right groups are receiving the same information and at the same time. And the last consideration on this bucket of training is about taking a look at what other incident management training topics would be beneficial. So like we said a little bit earlier, there's an emphasis on, what is a reportable event? How do you report it? But there are other tangential topics that would really help educate a lot of different people across the system on what is incident management? What are the things that I should be looking out for, and what really needs to happen when there are problems or issues. Some of the great ideas we got from providers, from self-advocates, were things like trauma-informed care. So especially after reportable events may happen, what are the things that should take place to help promote the resolution and solving those issues, providing more targeted examples of incidents, how to manage stress to prevent reportable events from happening. And self-advocates had this great idea of a get to know me video where, they could really explain, these are my likes, these are my interests, with all the different people that might be interacting with them, could help kind of onboard them more quickly to help prevent, again, reportable events from happening again in the future. So with that, like I said, we'll pause now. This slide recaps all of the considerations that we just presented. The gist behind the ideas for this section is that the goal is really to make things easier to understand, make the incident management system easier to understand, how to better use information to improve services, and then how to better educate folks across the system so that they can keep people safe and healthy. So with that, I'll pause. Feel free to raise your hand and we can select you to come off mute. And we'll also turn our attention to the Q&A options here. So just to recap, there was a question earlier that says, have you defined the KPIs for the provider report cards? If not, what are some of the standard KPIs? And Paul had a great response that, no, that hasn't been defined yet. And that's the work that needs to be done and can only be done with strong engagement and partnership. There's not, decisions being made without input from the providers. Any other questions or comments? Okay. Well, if folks are typing their question at the moment, we'll still keep an eye out and we can pause or potentially go back. But we'll continue forward to the next section, which is the discovery and reporting of incidents. So we're going to do the same thing, go through a group, and then pause for discussion there. The first idea that we have in this section is about developing alternative methods to report reportable events. So as this group is really familiar, the Only way to report reportable events right now is if you have access to the Evergreen system, and that's only a few select staff at each agency. What we heard was that, there's mixed thoughts about, this method, not wanting, everyone to be given given an account to the data system to be able to log things there, but wanting to make sure there's other options to report reportable events in the case someone isn't comfortable going to their case manager or provider to report things, and hoping that that gets into the system. This would really be a response to making sure that as many reports can be made as possible, especially when there's potential fear of retaliation or not feeling safe. Again, the focus being kind of alternative methods, not necessarily going through the same reporting directly into the system. Those reports can be even simpler, thinking about things of how like adult reports to Adult Protective Services are made. The next consideration we have in this is the idea of creating or distinguishing between critical and non-critical categories of reportable events. So this would not be about creating new categories of reportable events or getting rid of any, but it would be taking a look at what categories exist today and distinguishing which ones tend to be more severe or less severe in nature. Again, critical incidents being the bigger problems, non-critical being smaller. The point behind this consideration is by distinguishing between which ones are bigger or smaller issues, is it allows ODES to take a different response or ask for different requirements based on whether it's a bigger or smaller issue. So right now, every single reportable event needs a follow-up form. There could be a possibility of only the critical incidents need a follow-up form, as just a very simple example. The point behind this is, again, all about efficiency and being able to say more resources and time may be needed for bigger problems, the more critical incidents. How do we adjust the expectations and requirements so that less work, less tasks are needed for the smaller things that are really resolved and well documented, so that we can focus on ensuring health and safety in the bigger ones? Chris, do you have anything to add with that one?
Yeah, thanks, Aaron. And then the other thing I would add is specific to the changes at the federal level. So there's requirements around the access rule that Paul mentioned that are specific to critical incidents. And so it taking this step helps ODES align with practices that are required at the federal level as well.
Great, thanks for that addition. Moving forward quickly, the other consideration we have here is about just enhancing the ways that incidents and unreported reportable events can be identified. So right now, a big method to identify unreported reportable events is comparing ER claims data with reportable events data to make sure, anything that happened, anyone who went to the ER, anything like that, that was actually reported. So that's a great method and, used across states and as part of federal guidance, but there can be other opportunities to just make sure incidents are identified, looking at how to add that to, regular monitoring, on-site visits, things like that, just to make sure, again, that the only way to have a proactive incident management system is to really know what's happening on the ground. So always trying to make sure that in the case things weren't reported, easily forgotten, shared living providers, a family member, they're thinking about taking care of their loved one rather than reporting the situation, can all make sure that, all the data is there so that the right steps can be taken to promote health and safety. The next consideration is really a result of what we heard from the folks in this audience in particular. So the current rule right now is that reportable events have to be reported within 1 business day that they occurred. We heard a lot that, that prompt requirement is really important in making sure people don't delay the activity. However, there are a lot of circumstances in which folks may not even know an incident happened until after that deadline. And so even if people reported as soon as they found out, they're still, dinged or their compliance doesn't look as strong. So this consideration about changing the requirement so that reportable events have to be reported no later than 1 business day of date of discovery is really a reflection of a good faith effort between ODEs and reporters to show we understand the situations and circumstances you face. We don't want to incorrectly ding for compliance when that's not the case. It is still important, however, to, try and find out incidents happened as soon as they occurred, within that 1 day, 24 hours. And it can certainly be a metric to take a look at, why is it that certain incidents are being identified beyond 1 business day? That can be another part of patterns and trends to talk about, what's going on here? Is there any changes that need to be made to improve quality? But again, really about making sure that the requirement makes sense for the services. There's good faith efforts and partnerships between ODEs and providers, and that level of information can provide insight to what's really going on. Next, we have a consideration about enhancing notifications. So this was understanding that there's a lot of information right now that exists within the client data management systems, and that data may not always be getting to the right groups. We heard a lot from case manager supervisors that, for example, case managers will get a notification every time someone that they're supporting has a reportable event, but their supervisor may like that notification as well. So taking a look at the notifications and reports that exist, seeing which ones are beneficial, are they reaching the right audience, can others be adapted, really to promote the information sharing and that is crucial to making sure people can fulfill their roles quickly. The next, and actually our last consideration here, is about making sure that there's a prohibition against retaliating against reporters. So in the current reportable events rule and other rules, there's statements that, obviously say there cannot be any retaliation against someone who reports an incident. This is really about acknowledging, as the licensing rule, reportable events rule, as those are looked at, updated, can that language be strengthened? Can the mechanisms to reinforce that prohibition be strengthened? Are the ways to identify whether there's retaliation occurring or people do feel safe reporting? This is really about making it clear that in order to be proactive with incident management, reporting has to be safe from any retaliation or actions back. So making sure that there's no negative outcomes there. So with that, I'll pause. Here's the list again of all the considerations that we have in this group. This is, again, just recognizing that, in order for incident management to work, the system has to know what's happening on the ground and what incidents are taking place. So I'll pause. Feel free to raise your hand. I know we've been getting a couple questions. So some folks have been saying the date of discovery makes more sense. Couple others that were answered. Are there opportunities for different provider or case manager agencies' data to feed into Evergreen or ODE systems? Automated reporting would be great. That's definitely something to continue thinking about in the future.
I can jump in on one of these. from Catherine. She had a really good question. Is there a reason? So as we're talking about critical and non-critical incidents, I mean, it serves the purpose of splitting incidents into those two different groups for a couple of reasons. One is, the federal requirements around critical incidents. The other is certain incident types are just more severe and serious than others. And so it may provide an opportunity to have different timelines and take different actions and steps based on the critical nature of the incident. And so Catherine's point is, is there a reason that non-critical incidents couldn't be tasked to providers to manage internally, not requiring them also to be reported to DHHS? And from our perspective, it makes sense again that providers are taking an active role in investigating, reviewing incidents, taking steps to also prevent bad things from happening. However, it's important that those incidents are also reported to DHS or ODES to be able to capture the information. There has to be some level of review based on their policy, and then they can start looking towards that aggregation of information for tracking and trending. And so if we want to look at using data in a more proactive way, it's going to be important that information gets fed into ODES and doesn't just sit with the provider. And so I think that's something for further discussion down the road of what level of engagement and work occurs at the provider level versus ODES level in that review. But the reporting, we feel strongly that ODES needs the information to be able to analyze that and work with the different groups to take proactive steps. So
I see Catherine has her hand up. It sounds like she
Yep.
wants perhaps.
Yep.
Yeah.
Hi. Just to add on to that is I'm curious if there's examples of what might be a critical incident and a non-critical incident, and I'm not sure who mentioned it in the Q&A, but just if there's any ability of those non-critical incidents to find a way they can be reported in a more streamlined way by providers of not having to read, not having to have that internal process and then have to do a full reportable event. So it sounds like that's what you were talking about a little bit, Chris, is there may be opportunities to be able to report that information in a different way. But I was just curious of examples of critical and non-critical.
Yeah, that's a great point, Catherine. Thanks for jumping in and providing clarification with that. So definitely, I mean, there's I think you guys have discussed previously some events have more to do with health and safety issues, serious injury, abuse, neglect, exploitation is currently reported to APS, but also needs to be tracked by ODES. Those would be considered serious. But some of the things like medication errors, some of the other things that you have in here are ones that we would think, they're less serious in nature. The provider is going to be, you guys are going to be doing a review yourself. And then on initial report, some of these things that are of lower severity, in the report, you already provide information about what are those steps that you took to prevent that from occurring again. So we haven't talked about it yet, but one of the other things that we're talking about that might tie into this conversation, Catherine, is if it's a low-level event, if everything looks like it was taken care of, well, that's something that could just be closed potentially and not have to have a follow-up on. And so it's that additional work that would be occurring with more serious events that might not be required for less serious events, which could save some of that time. So, but more for discussion, and I think the quality improvement collaborative. That's one of the things that ODES is really invested in, and making sure that there's certain activities that are occurring now, but there's other things that really wanting to make sure that every partner is involved in kind of discussing the right path forward. So this is going to be something that clearly should be discussed as part of that. Thank you. It looks like Lynn.
Hi there. Um, Lynn Augustine, Creative Options. Along the lines of what Catherine was talking about, I'm thinking way back. We used to have it was a list. You knew that if something met the level of being reported, because it's kind of gone back and forth over the years. Either you report everything, or if it rises to the level of a reportable event, you report it. If not, you handle it internally. So eventually maybe having a list that kind of just spells that out for people, that might be helpful. And then you've mentioned a couple of times, Chris, the work still that needs to be done on what to do after the incident's reported. And I've mentioned before, I think there's sometimes confusion with the provider agencies about if it's a critical incident and it's going to adult protective, what does the agency do? Does the agency stand down? You stay out of it? You let adult protective do what they're going to do? Do you get involved? Do you investigate? I think having some real clear parameters around how to handle that in the future is going to be helpful as well. Thank you.
Yeah, Lynn, that's a great point. And then we'll pick up some of that around other information sharing and reporting practices and some of the other considerations. But I captured the note, and it's definitely something that we started with, wanting to look at that, how information is shared. And it is a very important aspect of how to be not just efficient, but also effective. So thank you for sharing.
There's also just a couple, just to recap in the Q&A, there was a question about whether OATS has a QIO like entity contracted for aging services. And the answer is no. The intent would be to select a QIO with help with HCBS across populations. Another question or comment was, having never heard of staff getting disciplined for reporting by the agency, but have heard of staff who are worried about retaliation from coworkers or from, alleged perpetrators. So wanting that perspective to be a part of the effort to really make sure retaliation, it's clear that's not allowed or okay or any of those things. Any other questions? Oh, Michelle, yeah, go right ahead.
Yes, this is Michelle from Golden Group Home Services. I have a question here. My question is, if there is an incident and something that has been reported and APS is involved, whether the investigating what happened and staff is involved, they do investigation. Sometimes us as providers, we sometimes we don't get to know the result of the investigation. The APS sometimes they will say we are investigating, and they will take like a longer time, or we will sometimes it elapses without telling what is the result of the investigation, whether the investigation has been closed or is still pending, what's going on. It stays until people start wondering, is this investigation still going on? Has it been closed? What's happening? So most of the time we need to reach out again. Sometimes we don't get the right hour or the message. So is there a procedure when investigation?
Did my mom let you know she wasn't coming?
Is there a process, a procedure to inform the providers the result or the outcome of the investigation?
Thank you for asking. Notifications are one of the things that we do have in here. It's identifying when those notifications are occurring, either during the investigation itself, in case people are continuing to be at risk of continued abuse or potential abuse. And then there's also notification that occurs after an investigation through APS occurs. And that typically occurs to the provider that is where the event occurred. And we know that direct support professionals can work across providers, so that provides some complexity. And we talk about that in one of our other considerations. But notification is something that we also suggest, be looked at and strengthened, so that people are aware of the status and what's happening with investigations or events. So some of it, can be automated through the system, but some of it can't be. And so, the process that those notifications go out under need to be evaluated. And as that's being looked at, just keeping in mind that certain information is going to need to be protected as part of the existing rules or laws around APS. But it's a good point. And it's included, and you'll see it pop up here later on in this presentation.
Great, thank you for that question. So in the interest of time, we'll keep moving. There were a couple other questions that have answers in the Q&A. So this next section is going to be really quick. We just have 2 to cover. This is the review and investigation portion of incident management. So the first is about taking a look at the timeliness of reportable event triage and review. So again, kind of expanding upon the idea of changing the processes that are followed on ODE's side when distinguishing between critical or non-critical incidents. Thinking about, what are the processes and approaches in place for reviewing reportable events, and how do we make sure they're done in a timely manner? Could critical incidents be required to be looked at more quickly than non-critical? What are the things like working with the QIO to help take off some of that desk level review and initial triage, just to make sure that's all done quickly? Again, the important piece here is obviously the big part of incident management is making sure action is taken after things are reported. So being able to get to resolution and action quickly is really important. Second piece here is taking a look at the structure for how ODES does its triage and review, and just making sure that structure still makes sense and is being applied consistently across the districts, across the teams. So with considerations of whether things, whether there would be critical or non-critical distinctions, that could influence, how likely certain incidents are to be categorized as more severe or not, making sure that structure still makes sense for the types of incidents and types of reports, and making sure that that's applied consistently and in a standard way, so that, the same different caseworkers would respond the same way or triage something the same way. I mentioned that was quick. That is the end of that section. So again, I'll pause and see if folks have any questions about those 2 considerations. Yeah, Michelle, go ahead. Let me get you. Michelle, do you have a question on this section?
Okay. Yes. It's it's about investigation, but we are talking about investigation here. It's let's say, for example, one of our staff is being investigated, has been 4 months. We don't know the outcome. Should we reach out knowing that to ask for the result or the outcome, or since we haven't heard from APS, that we just assume that has been concluded or has been cleared? So that's a question. The other question is, for example, if there is an investigation against a staff in a program, I know, and that staff hasn't been proven guilty, or staff is something just is being investigated. The question here has been, while this investigation is going on, should the staff hasn't been proven guilty or involved. The involvement has not been determined yet, or to determine if the staff is at fault or he's not at fault. Should this staff continue working while investigation is still going on, or this is just left for the agency to provide a judgment? Or is there any protocol for this staff? Can company agency suspend when when the investigation is still going on, when somebody has not been proven guilty, or we have to wait until the result of investigation is over? Those kind of questions. Thank you.
That's a great point. And you actually anticipated something we're going to get to in the next section. And Chris talked about this before. We have actually in the next group of considerations about the resolution and follow-up. Michelle, you just acknowledged something that we've heard a lot in the last few months, of that confusion of what do I do during the investigations? What are the best mechanisms to keeping people safe? And so I'll pause and say we'll get to that specifically, but we do have some ideas to answer some of those confusions specifically. And then if that still doesn't make sense, you still want to hear a little more, we can definitely come back to that question then. Really appreciate it. Okay, well, in that interest of time, I'll move forward to that section, walk through those really quickly. So this is on the second to last group, resolution and follow-up. Responding as well to something, Michelle, you had brought up of enhancing communication about resolution. So not only APS investigations, but after reportable event reviews. Case managers right now receive a notice when there's been a reportable event reported, but there's no notifications that go out to any groups when the quality assurance team has finished its review, or a follow-up's been submitted. It requires a lot of manual review of information, reaching out, seeing what happened. So this is about taking a look at what are the mechanisms to communicate the progress of reportable event reviews at the different stages, who needs to be informed of progress updates, what's the right level of information, and how would that information be shared, just so that there's a little bit less of this limbo and waiting for information or to know when to take next steps. The next consideration we have here is taking a look at the corrections processes and systems and making sure that those are handled appropriately in an efficient and effective manner. So this is really about understanding that, sometimes things rise to the level of plans of corrective action. What is the system for developing that? What are the steps and processes? Can there be ways to streamline? Can there be ways to better document information so that the expectations are clear? What's being documented? What are the issues? What's the resolution needed? All to, again, make sure there's strong partnership between the state, between different agencies, so everyone can work together to improve problems and address them in a quick and effective way there. The next two are related to each other. So this is all about what to do after, what to do for the follow-up for reportable events. So this group's really familiar with, after you report a reportable event, you also have to submit a follow-up form within 30 days. This is for all reportable events, and the person who submitted the report has to do this follow-up form. What we heard was that can often be a really cumbersome process, especially for the smaller issue incidents where It was resolved right away, and even in the report itself, that resolution is very clearly documented. So sometimes the form is, additional paperwork of things that have already been documented. Sometimes it's tricky to know how to fill that out. What we saw in other states was that not all incidents needed a follow-up form itself. So this first consideration is proposing to change the rules about follow-up so that the requirement would no longer be every reportable event needs a follow-up form, but only when the quality assurance team or incident reviewers would determine more information is needed in a follow-up form. The important point about this would be that, for those smaller issues that were resolved right away, this should really reduce the manual burden. If you can document that resolution and here's exactly what happened and everything's okay in the report itself, no need for another form. No one's going to need more information. That can be closed and taken care of quickly. For the more complicated reportable events, those by nature may take longer to resolve, and not all of those action steps or remediation could be documented in that initial report. So it would make sense that more information is needed. Another follow-up form would be needed, but it would be on the responsibility of the state side, the reviewers, to say, okay, I've taken a look at the event report itself. I need more information to be able to know that how things were taken care of, what was the resolution, and requesting the form that way. Chris, did you have anything on this before we move to the second one?
Yeah, thank you, Aaron. It's just a reminder that everything would get a look. So everything submitted would be looked at by ODES. And then ODES would make a determination whether or not more information was needed to determine that everything has been taken care of. And so it highlights the importance today even of being complete and comprehensive in what you're reporting with the incident or the reportable event. So
great point. So the second piece about the follow-up changes is taking a look at the role that case managers could play in follow-up. So like we just mentioned, the reporters themselves complete the follow-up form. What we saw in a lot of states was that case managers had more of a role in completing the follow-up forms or documenting the resolution or what happens after these incidents occur. And so this consideration is about changing the rules so that, rather than the reporter being required to submit the follow-up, the case manager would play that role. This again acknowledges that there's a lot of workload on case managers' plate, so tying the consideration we just mentioned in hand with this one, that not every incident would require a follow-up form. This also recognizes that case managers are already fulfilling the role of reaching out to the member, reaching out to the provider, their family, figuring out what happened, updating plans, updating approaches as needed to take care of the situation and documenting those in progress notes. So there's a lot of work that's already being done by case managers that is very similar to the work done for the follow-up form. And so streamlining that process, making sure it can be documented in the follow-up form with the incident itself, rather than a separate page and progress notes, can really just acknowledge the important and valuable perspective that case managers have in really documenting how everything was taken care of. And I'm sure we'll get questions about that, but we're going to move forward to the last two. And this is what we had mentioned earlier. We were going to get to this later. We have a consideration here about establishing a law that would outline what the requirements are for agencies when there are investigations and substantiations for abuse, neglect, and exploitation. So this is exactly in response to what we heard over the last few months of the sometimes confusing guidance of what do I do when there's an investigation happening. Some agencies have their own policies to say, okay, if someone's being investigated, we're going to take them off the floor, out of direct service, not terminating, but just at least removing from the floor while this is happening, just to make sure other folks are safe. And then, what to do after substantiations. What does this mean? How do folks find out whether people were substantiated for alleged abuse or it was found they were not involved? This is really just to acknowledge that there's a need for a central directive on this at times confusing issue. There's a lot of challenges of recognizing the pieces of the adult protective services rules that are in place, due process protection. So the exact elements of this law or approach are not determined yet, and collaboration between providers and the state is going to be really critical in this. But recognizing there's a need for some kind of guidance and directive on this to make sure people are safe. And then lastly, also something that was mentioned of just not, sometimes not finding out what the result of investigations were. So the process for after someone is substantiated, there's the opportunity to appeal that substantiation. And it's not until the appeals process is done that someone would actually be added to the Adult Protective Services Registry. And even there, that information can't necessarily be shared with too many other groups. So this is a consideration about taking a look at methods for ways to make sure that once someone is added to the APS registry, there's been substantiation, due process has taken place. Employers of record are notified of that, similarly to how employers through the main background check center are notified whenever there's things added there. Again, this is not something that's been outlined. This is exactly what's going to happen, but as a consideration of there's a need to modify the approach of how this information is shared. And so with that, I'll pause. This is again the wrap up of that list of considerations, and we'll turn it to any questions. Pause just a couple more seconds just in case folks are typing.
As a reminder, after this session is completed, we do have plans. OATS has plans to post the report through their websites. You'll have access to the full report again. There's also a dedicated email to provide additional feedback and input. So if you don't get a chance to pose your questions during this event, there's another mechanism where you can submit that. And again, really appreciate everything we've received so far. And ongoing collaboration is going to be essential for moving these considerations forward. So thank you.
And someone just asked, what about notification to separate employers that were not the employer that made the report? That's actually exactly what the issue that OATS would be trying to resolve there. Seeing, sometimes it's tricky to know exactly where someone is employed if they're employed at multiple places. So there's a lot of different methods to be able to getting that information and then how they would be notified. But that is the attempt or the intent or something that OATS would be trying to overcome in that approach. Okay, so in the interest of time, I'm going to move to the last three considerations before we wrap up. And again, if you have follow-up questions on any of these, we'll come back to them. So the last section is our analysis and information sharing section. So the first of these is just formalizing the process for sharing information. What we mentioned before, and really is a strength, is that there are lots of opportunities or lots of informal methods across the state with providers, case managers to share information. So just formalizing the expectations of what data, what information needs to be shared, when, in what forum, standard reports, how do data systems interact. really just establishing those clear expectations and rules so that everyone has the information they need to properly go about their roles and their piece in incident management. The last two are things that we talked about at the beginning of things that are moving forward sooner. So the first being establishing an internal incident review committee. So this would be about identifying the staff and groups internal to OATS that should come together on a regular basis to take a look at incident data, to be able to look at patterns and trends and identify whether there are some broader system issues that need responses rather than just individual things that need responses. This is something we saw in a lot of states, and although OATS does a lot of this informally, establishing a formal group to organize that effort would be beneficial. And then the last consideration is, again, something that has been brought up before, but is about establishing an external HCBS quality improvement collaborative. So this is about acknowledging all the things we talked about earlier of needing to bring different groups together to talk about things, not just incident management, but quality as a whole. There's a lot coming up with this, and when we turn it back to Paul and Betsy, they'll be able to kind of reiterate the points they made before, but more announcements will be made about this. It's not just going to be focused on incidents, though that is a piece of quality as a whole, as we've talked about. And it's really to show that the representatives of all different groups across incident management system are important and needed to promote quality. So with that, we have reached the end of our considerations. This is the end of that last section. I'll pause to see if there are any questions about this section specifically, and then we'll turn to just some wrap-up comments and discussion. We've got a question and we're getting an answer tight, which is good. So just to recap that, so the question was whether all of these considerations and changes apply to sections 18 and 20 as well. The considerations, and this project was specific to 21 and 29, but there's always, a need to, or a desire to find opportunities to align practices across programs where possible.
Yeah, thanks for that response, Chris. I completely agree with that. And this is something that a question we've been taking up also as we look at the access rule. I think for our efficiency and for yours and for our effectiveness, to the extent possible, having systems that work across multiple programs is what we're looking for. Everyone deserves the same level of quality, regardless of which program they happen to fall in. So that's what we're shooting for.
Okay. Well, with that, I will turn it back to Paul and Betsy just to kind of recap, what are the next steps from here? And we can answer any other questions as needed.
So thanks, Erin and Chris. And I do want to just, I meant to say this in the very beginning, but I forgot. We so appreciate the work that you all have done with us here in our state. And, I've heard really very positive things about the work you did with all the focus group work. And so we're really excited about the considerations that you've put together and wanting to move forward with as many of them as we can, which I sort of talked about a little bit earlier. So these slides are the same that I went through before, but now that you've heard some of the recommendations that we've gone through, maybe they might make a better connection for you. But as I've mentioned, we do have things that are in place that we've already addressed, and we addressed them early on because we got feedback early on from some of the focus groups, and we sort of said, oh, we can do that now. And one of those is definitely having some better communication across the QA and APS work that happens out there. We've already talked about the new technology and the dashboard that was mentioned in a couple of questions here is, can we have access to that? And the answer will be yes, we want to track and trend information and share that publicly across for providers, for family members, for others, because we've heard loud and clear that that's a real need in our system, as well as the tools I already mentioned. And we've already talked about the licensing rule, which, as Paul mentioned in our response, will hopefully be shared for public comment this summer. And then lastly, on the last slide, just, these are just some of our pieces that we're hoping to address over the course of the next year or so, couple of years. Might be, some of them will be sooner, some of them will be later. You'll be hearing this summer about the implementation of the Quality Improvement Collaborative, which, as Paul answered in a questionnaire, will be made up of a variety of different interest holders, including providers and family members and self-advocates and advocacy organizations. We'll see that collaborative as being really key to helping us move forward with all of this work, because we have a lot of things that we need to address and a lot of pieces of this work, as you heard, that still need to be worked out. And we see that collaborative is helping us do that. So I think I've already gone through the other things previously. I don't really have any other things to say, except thanks to everyone for joining us here today. And we look forward to working with you going forward.
Yep, let me add my thanks. Really appreciate your time. Thank you all.
Thanks so much.
Thank you, everyone.
Take care.
Thanks.